Hi everyone, my name is Morgan Medellin, and my teaching strategy is a case study on Guillain-Barré. It is a mix between video and photo montage, so I hope you learned something. Have a great day. A 54-year-old male presents to the emergency department with complaints of full body numbness and difficulty walking for 1 day. Upon arrival to the emergency department, vital signs, history, and medications were obtained. Blood pressure 154/90, heart rate 80, oxygen saturation 97% on room air, temperature 97.5, respirations 14 with no complaints of pain, weighing 220 pounds at 5 foot 11 inches. A CBC and BMP are sent to the lab. A CAT scan, MRI of head, neck, and spine are sent. An EKG is performed to rule out heart attack. The ER physician completes their history and physical. The patient is not allergic to any drugs and takes no medications at home. After a review of the systems, neurologically, the patient has numbness and tingling over entire body. He is an ex-smoker, quit 6 months ago, had a sinus infection last week that cleared without antibiotics. GI, GU, and peripheral vascular are all within normal limits. Cardiac-wise, the patient is hypertensive but not taking blood pressure medicines. The patient lives at home with his wife and drinks 3 to 4 beers per day. The patient stated the symptoms started the previous night in his hands after mowing the lawn. The next morning, the numbness and tingling had spread to the entire body, and walking has become more progressively difficult with no complaints of pain. After review of the tests and labs, the patient will be transferred to the Texas Medical Center for further testing and a neurology consult. We will give lisinopril for blood pressure. The patient will be transferred via ground air ambulance to the Texas Medical Center, Houston Methodist. At this point in the case study, let's reflect on the things we know. The labs and the tests performed have come back normal. The CT scan and the MRI both showed degenerative changes with mild narrowing in the spinal column. Labs were within normal limits. EKG was normal. Blood pressure is high. Lisinopril given to help with blood pressure. A couple of questions we can ask upon arriving to the med center. What further testing should be performed in order to make a definitive diagnosis? What other team members can you expect to be consulted to see this patient? And what are some potential diagnoses that have not been ruled out yet? These are some questions to ask as we continue this case study. Labs, CT, and MRI are repeated. Physical therapy and occupational therapy are consulted to evaluate and treat. A spinal tap is performed in order to rule out an infectious disease. What additional testing may be ordered to test muscle damage? Why are physical therapy and occupational therapy so important? Since the spinal tap has ruled out an infectious disease, what other processes can affect our nervous system? Think autoimmune. After merely a process of elimination, neurologists determined Guillain-Barré was the diagnosis. Guillain-Barré is an autoimmune disorder where your immune system attacks your nervous system, causing nerve damage or acute neuropathy. A treatment process was decided of intravenous immunoglobulin G or IVIG daily for 5 days. They also ordered an EMG or an electromyogram to determine if the muscles were affected and damaged, and this resulted in a normal test. The patient was discharged from the hospital after the treatment and was to have outpatient rehab and follow up with neurology in 4 weeks. After successfully being discharged from Houston Methodist after the treatment of IVIG, my dad was able to attend outpatient rehab at Houston Methodist Willowbrook. We just want to say thank you for all your hard work and keep up the good work. Thank you. As you can see, Guillain-Barré is very near to me. My dad was diagnosed with Guillain-Barré just 3 months ago and has almost made a full recovery. We want to thank the doctors, the nurses, and the physical therapists that have helped him through this process and through the rehab. Guillain-Barré although comes in many forms and fashions, can be life-threatening if not caught and treated as quickly as possible. We were lucky and my dad only had full body numbness, but it can lead to paralysis in just a matter of days of the first onset of symptoms. So I hope you've learned the signs and symptoms of Guillain-Barré and you can use this in your practice. Have a great day!